disturbing sign. What's your view of this?
I would broadly agree. I think that one of the things that's more disturbing than government action, particularly from the perspective of where I'm sitting here in Ireland, is how popular some of these measures have become in a very short period of time. Um, you know, since the Irish government introduced vaccine passports, they were originally introduced on the basis of the idea that they would reduce the spread of the disease, that they would stop people from catching COVID, and that they would encourage people to get vaccinated. And in that time, there has not been one shred of evidence presented to the public that suggests that they actually do either of those things. We have not had one scientific paper showing that vaccine passports reduce the spread of COVID one way or the other, or that they have meaningfully increased the number of people vaccinated one way or the other. In fact, since they were introduced, the rate at which new people are becoming vaccinated has actually slowed, mainly because in Ireland we very quickly reached the high 80s in percentages and are now in the mid 90s. So these measures remain targeted at essentially in Ireland. And I'm, by the way, I'm triple boosted myself for better or worse. But there are 7% or so of the Irish people who are not vaccinated. And yet we have this immense public focus on that 7% as if they are the root cause of all the nation's problems. And as you alluded to, here in this country, the media coverage on this issue has been entirely in one direction. We're now at a position where we had hundreds of thousands of cases, which in Ireland, we have a very small population, about 5 million people. We've had hundreds of thousands of cases in January alone of this virus. The wave is falling. At no point was our hospital or health system threatened. We are told that these measures are in place for a public health emergency. And yet, if you look around at this point, there is no actual sign that there is a public health emergency. That's the thing I think that disturbs people. We have something in Ireland that dictates our policy called the National Public Health Emergency Team, which is a series of medics who basically meet and announce what the government may or may not do, in effect. The government then listens to them. But when you think about that name, public health emergency, we don't have a public health emergency. There isn't a public health emergency in the UK or in Scotland or in Wales or in Ireland. And yet we still have measures which are directed at mitigating the effects of this emergency by effectively targeting a small portion of the population who are viewed, quite absurdly in my view, as dangerous.